Why do my eyes get puffy to the point where it looks like I have monolids? I'm Asian, and both of my eyelids are double lids, so sometimes when I wake up, why do they turn to monolids? They stay that way for up to 2 weeks.
Thank you for your question. You submitted a question without any photos, but you're asking about a situation which I think I can assist you with. You describe in your question that you're Asian, you have typically double eyelids, but there are times when you wake up a little bit more swollen and you end up having monolids, and it can last up to 2 weeks, and you're looking for an understanding as to why this happens. Well, I can certainly give you some understanding of this based on my experience. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. One of my areas of specialties is Asian eyelid surgery, both primary and revisional surgery. And I've been in practice in Manhattan and Long Island for over 20 years, and I've done a lot of different variations to help our patients achieve their desired look. So I can say that you have a situation which is actually not that unusual, and it comes down to basically understanding some anatomy. First of all, in terms of definition, a double eyelid or an eyelid or an Asian crease is basically something that occurs in general around 50% of people of Asian descent. And what that means is kind of a little bit of a fold where you see a little bit more of the eyelid from the eyelashes or the margin to the crease. And then the opposite of that is a monolid where you don't see that crease and you just see the top of the eyelid platform in a way where you don't see a defined fold. So what differentiates one from the other are attachments. And these attachments are anatomical attachments between a muscle called the levator muscle. The word levator is like the word elevator. It's the muscle that lifts your eyelid. And this muscle has little fibers that come off of it that attach to the skin. When somebody has a strong crease, it means they have a strong attachment. And if somebody has some variability, well, very often it's because they have multiple fine attachments that are a little bit weak, or they don't have any attachment at all, but that the crease that they do see is actually just passive folding of the skin. When I perform Asian eyelid surgery, there are basically two techniques. There's one called an incisional surgery, where an incision is made to remove skin and to address fat, or non-incisional surgery, where little openings are made and the skin and the muscle are attached using stitches. In the end, either procedure is intended to engage the skin with the levator muscle, the muscle to create a more consistent, permanent connection. So I think it would be reasonable to believe that in your situation, with puffiness or waking up with some fluid, you can be maybe straining some of those connections, and those connections are just not strong enough to bounce back and create this consistent crease. And I've had patients report that when they are a little more dehydrated, their creases get deeper, which makes sense. And in other situations, it could be just from allergies or sinuses or salt intake that can make the eyes puffy and cause that crease to be less obvious. Again, understanding the principles of Asian eyelid surgery should give you an idea of why you have some variability. Basically, it has to do with the anatomy of the muscle attaching to the skin. If you have a stronger attachment, then even with swelling, the crease will still eventually be a little bit stronger, and you won't have this absence of crease for 2 weeks. I think that something to explore is why you have swelling when you wake up. That's a little bit more than unusual, than is typical, and why you don't have that consistency. If you really want to have this constant double fold, then you may want to even consider Asian eyelid surgery. We have patients who actually, before they have this procedure, actually will put little strips of tape that are specially designed to create a crease just to see how they like that crease and how it looks. And then we work on deciding whether to make it a nasally tapered fold and a parallel crease and things like that. But it might be worth also considering trying that just to see how things look. You may want to discuss this option of maybe doing something more long permanent so that you have a more consistent look by meeting with a qualified, experienced cosmetic surgeon who does a lot of Asian eyelid surgery. So again, in summary, the fluid may be causing a stretching or just a natural volume occupation of this area so that the double fold just doesn't form. Or you just may have a situation where this may be an opportunity to look into an Asian eyelid procedure if this is a desired look that you want to be more consistent with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.